Welcome to Eurofins ViraCore Clinical Diagnostics Podcast, where I'll be sharing up-to-date scientific advances, key diagnostic testing, and our most recent innovations. Welcome to our podcast. This is our fourth year hosting our live in-booth interview show, Transplant Radio. Our aim is to connect with the transplant community, a diverse group that includes professionals, donors, patients, and even doctors who are also recipients. If you'd like to be a guest on our show, you can find our email in the episode summary. Amplify your influence on Transplant Radio. Enjoy episode 5 of our 15-part series.
Good morning, it's Kevin Foth from Transplant Radio, Amplify Your Influence. We're joined today by Dr. Alin Gragossian. I'm sorry, I butchered it last year when you spoke with us. At least I'm consistent.
It doesn't bother me.
Welcome. Appreciate you coming back to talk. As we were talking just a little bit before we came live here, you've been busy, but you've also been supporting your causes and other attributes that you've been working with over the number of years. You are, just give a brief overview of what I've found out about you and refreshed on you. Is you're an intensivist, physician leader at Equium Medical. You hold a position of Associate Medical Director at Donor Network West, located out here in sunny San Francisco, where WTC2025 is. Nice to be out here. Beautiful city. And as part of your associate director, you guide the organization's donor management initiatives. Is that correct?
Correct.
All right. Just want to make sure, because the internet, even though you can get an answer in milliseconds, it may not be the right answer, or it may be out of date. So I want to double check on that. But as part of Amplify Your Influence and talking to people like you, not only are you a physician, but you're also a transplant recipient.
Correct.
You want to talk a little bit about how you were out one night having fun with a bunch of friends, and it's like, man, I just don't feel so hot.
Yeah, that's very similar to what happened to me. So at this point, it was 6.5 years ago, December of 2018 into January of 2019. I hadn't been feeling good for a few weeks. I think it started right around Halloween of that year, and I remember Halloween just because I remember I was kind of feeling sick and couldn't go out. So between Halloween and mid-December, I felt like I just had this prolonged cold, and I had a cough that wasn't going away. And sometimes that happens. So if somebody has like a viral illness, you have a cough for even up to 6 weeks after, and that's normal.
Right.
So I assumed it was that. And at that time, I had been training in emergency medicine, almost done, but I was basically a resident doctor, and we're always sick, right? Like, we work 80 hours a week. We're constantly sick, so I didn't think much of it.
Right.
And the next thing people usually ask me is like, were you able to work out? Like, other than that cough and like just overall feeling just like fatigued, I was fine. I was still working out. I was still going out with my friends, or at least not as much as I, like, for example, not for Halloween, but here and there we would still go out. So it was nothing that was like keeping me from living my life. But when things got worse by mid-December, I was working in the ICU as a resident. So as an emergency room resident, we always cover the ICU as well at one of our hospitals. So one of our attendings actually realized that when I was trying to...
It's been a while now. Goodness. Going okay over there?
When I was trying to present a patient to her, then she told me, she said, you're kind of working to breathe while you're trying to explain this patient admission to me. And so she was the first one who kind of noticed that something was definitely off. The next day I felt even worse. I went to the hospital. Long story short, I got very, very sick in those 24 hours, and they had to resuscitate me, put me in the ICU. Just within a couple weeks, I was, diagnosed with dilated cardiomyopathy, and had to get transferred to Penn. when I was at Penn, the only thing that they could have done for me was they had to list me for a heart transplant. Now, keep in mind, I had never had any medical issues. I was 30 at that time. Barely even would go to the doctor myself, but then I was diagnosed. And then we eventually found out that it was a genetic mutation that me and my dad share. And, his dad had died of heart failure, or had died when he was 40, but this was in the 60s or 70s, so I don't think they really looked into it. But nowadays, a 40-year-old dying of a heart issue is a big deal. We would think maybe that's genetic. So we found out it was a genetic issue. Eventually got my heart transplant. A couple weeks later, got discharged, and tried to do as much as I could while, I still wanted to go back and finish my training, which I did.
You're still in that 80-hour mindset.
Exactly.
And I got to get this done.
Exactly.
I got to eat not the most healthiest food, but something that'll give me some nutrition. Yeah. Maybe sleep 2 hours on a good day. No stressors in your life during that time, right?
Exactly. So there were, obviously there were stressors, but and when people ask me how did you do it, I don't know if me already having that, I hate using the word resilient, but kind of that resilient mindset for, working all the time, and we're always used to just working through our illness, and so that probably helped me recover, because the only thing I wanted to do was just go back to work. So it was kind of crazy, but at the same time it did help me heal, because I knew that there was something that I had to go back to. Mm-hmm. So yeah, it was total craziness. Till this day, when I tell the story, I still get goosebumps, because I'm I don't know how that all happened to me, but it did, and now I'm here.
Well, and I've heard some people describe that as the warrior mentality.
Yeah.
People are relying upon me, so I've got to step up, I've got to do it, and I'm going to do it to the detriment of myself.
And that's a really good way to look at it. I do feel like sometimes we overdo it. It is okay to take a break and rest, but I do think in that moment, especially for my personality, it was definitely something that helped me get through.
Right, and then being able to transition that into
exactly
your self-care, your healing, and that going on. But talk a little bit about it, if you could, your thoughts and feelings during the, hey, I'm not feeling so good, to waking up in an ICU bed going, I need a what?
Yeah. It happened so quickly that until this, because people, they ask me, how did you feel? What did you do? I don't remember. I remember it was something that had to be done. There was no other option. So I feel like I really processed that time period later, like months later. I was whoa, how did that happen? So in that moment, I think I was scared. I was in a weird position, because I was a physician. Sure, as an ER doctor, ER resident, I didn't know that much about transplant, but I knew the basics. I knew a little bit about what they were talking about. And so, so for someone like me, it helped knowing just as much as I did know. I didn't want to know too much, because sometimes, it's better to just kind of not think about those things. And then I just kind of had to do what I had to do. Then months later, I really processed it and thought about what a crazy event that had been in my life.
And so, just thinking about it, you're probably at the time ER resident. Mm-hmm. You said, oh, okay, this person's going to need a transplant, I'm going to transfer them to a different service, wipe the hands, they're gone, I'm moving on to the next one. But now you're sitting in that
exactly.
bed, and it's well, wait a minute, how has this helped you as a physician deal with your patients who might be going through the potential of needing a transplant, or those that definitely need a transplant, and it's changed your mindset, your outlook, and your approach?
Definitely. I think having been a patient definitely changed my clinical practice. Not so much the medical knowledge, right? That just, with time and with training, you learn the medical stuff. But the little things, is there really a point to making a patient wake up to get their labs drawn at 4 a.m.? No. If you can wait till 6, that would be really helpful for the patient, because we never sleep as patients in the hospital.
Right.
So little things like that. Or when you're going into a patient's room and they just want, I hear doctors do this all the time, but if a patient asks for a blanket, and there's so much that you're already doing, you might forget. So make it a point to be mindful about what that patient asks for. Who cares if it's a blanket? Just go get it for them. So a lot of little things like that, and overall just being more empathetic about what they're going through. And I think I said this last year too, or I've said this many times before, but I don't think you need to go through something like this to be a good doctor. But as long as you understand that a lot of, there are things that you don't understand from a patient's perspective, and then, there are people like me who are very open about it. So as long as you're willing to grow from others' experiences too, that also helps. I don't think a good doctor means that you've been a patient yourself.
Right.
So it's just been interesting.
So Party, you said you've been very open about your experiences pre-transplant, post-transplant, but you also started a blog shortly after your transplantation. Was that cathartic for you and being able to speak to an anonymous audience, but to still say, hey, this is what happened to me, this is what I want people to know? And talk about that experience.
Yeah, of course. So I did start a blog. If I'm not mistaken, my first journal entry was something like, this is post-op day 7 and here I am. And I didn't put that much thought into the blog. For me at that time, it was just the easiest way for me to write out my experiences and not have to text everybody at the same time. So it initially started as me just writing about what had happened to me so I could send it to my friends and family so I wouldn't get phone calls all the time. And then
answering the same question again and again and again.
Exactly. And then it turned into something bigger. A few days later, I was like, well, why don't I do some fundraising through the blog now that a lot of people are reading it? And then, a few months later, I decided to add resources for transplant recipients, resources for donor families, things like that. And so over the course, I still update it as much as I can. Obviously not as much as I was before, because there's just been so much going on. But I did start it initially as just a way for me to express myself, and it turned into this bigger way of me connecting with others. I got so many emails from other recipients saying oh my God, it's so nice that there's a young person who also got a heart transplant. Everything was so sudden. This happened to me too. I don't know who to talk to. So it was great.
And so the name of your blog, and it's still out there, is called A Change of Heart.
Correct.
Great title. I love that. And so this evolved, and then you met another individual who's a heart transplant recipient, and the next step in your journey in educating folks.
So I within a couple months of my transplant, I got a message on Twitter from Kobe Salerno. He had been an internal medicine resident at the time in, I think, somewhere in Connecticut, and he had told me that he's a resident, he has a heart transplant. At that time, he had a heart transplant for 5 years. So for me, I was like, wow, that's amazing, that's so awesome. And so we connected. We became very, very good friends, and eventually he told me that he had always wanted to do a podcast called Both Sides of the Stethoscope based on his experiences. And so we started that together, and it's still going till this day. And it was, first of all, it was very nice meeting someone who had been through something similar. His story is a little bit different from mine, but similar in that we're both doctors with organ transplants and have to navigate kind of being in this weird space in between. But on top of that, it was just nice doing this podcast with him because we were able to educate others. We try to make it general, medical related, but obviously a lot of it has to do with heart and transplantation because that's what we're closest to. So it's just been a wonderful experience trying to do different, we do some interviews sometimes, we do education sessions, we do, recently there was a New York Times article about DCD organ donation, so we tried to kind of bust some myths about that, and so it's been really wonderful.
Yeah, and it's a great listen to, and if you don't like listening, you want to see the people talking, the next evolution for both you and Colby is...
We did start our YouTube channel. For me, it's a little weird because we've always recorded them, but we finally decided to actually post them on YouTube, so now our recordings are on YouTube as of 2 weeks ago. It's still called Both Sides of the Stethoscope, and you can find it on YouTube or on the podcast channel, whichever you like. I'm more of a podcast listener, not so much of a watcher, so that's the route I usually go on, but plenty of people who want both.
So I guess I just have to equate that to, I'm out of the Kansas City area, big Kansas City Chiefs fan, so I watch the New Heights podcast. So what's the viewership difference between what a New Heights podcast is and Both Sides of the Stethoscope?
What is New Heights?
New Heights, it's the two Kelsey brothers, Jason Kelsey and Travis Kelsey. They get on and basically bust each other's chops over football and life.
Very similar is our podcast.
I'm sure a lot less profanity though than the New Heights. They have to bleep a lot of stuff out.
I would assume that we probably have a lot of the similar, like age group, right? The audience is probably similar.
Same demographic.
Exactly. We do focus more on probably medicine than they would, but I think that ours is just as good.
I would agree. So they're both. I mean, if you want good, honest, informative answers, both sides of the stethoscope, answering those questions. If you like just good brother beating up on brother conversations, New Heights is right there as well. But and I've had the pleasure of meeting Colby. I've had the pleasure of meeting you before, and I kind of see you as Colby in some way in a bit of a fraternal relationship.
Oh yeah, for sure.
You know, brother, sister, you going back and forth and
absolutely
poking each other where you can when you know that you're going to get the response you want.
Colby is definitely a lot more of an optimist than I am. We'll put it like that. And I mean, I tell him, I'm like, I'm an ICU doctor. I can't, like, there is no optimism here. No, I'm just kidding. But and we do have, you know, some, but you know, we've known each other for so long. He's like my brother at this point, and we always do things like that.
Yeah, I was talking to a gentleman yesterday about it. I said, you know, really, the Hawaiian word ohana fits. You know, you don't have to be blood relatives to be family. It's the relationships you build, and that's kind of what I see between you two as well.
Absolutely.
And such. So, let me see. I've got a few notes on you here. I want to make sure I've got everything we talked about. So, what are the top things you want people to know about organ transplantation?
I want people to, especially right now, there's so much going on as far as what people are hearing, reading, in the media. I do think one important thing to put out there is that right now, and you know, if you need a transplant, a lot of people are afraid, like, am I going to get one? You know, is everything going to be okay? And I trust that the system, even with all this controversy, everything is still going smoothly. I don't think people should be worried about those things. And you know, making sure that people understand that, you know, these things come and go, but ultimately our focus is always on making sure that our patients are taken care of and they're getting what they need, even transplant recipients when it comes to their medications or whatever it is, or if it's somebody who's waiting for a transplant. And if somebody is truly worried about whatever situation that they're in, another thing that I tell people is to utilize the resources that are available. Plenty of resources that people, I mean, there's so many, but people just don't know where to go for them. Exactly. So if there's like a centralized place for all the resources, but I always say start with your hospital social worker, see what they have, because there are so many different programs that need to be utilized, and people could be definitely using them.
And the importance of that too, as we've talked to people while here at the World Transplant Congress in San Francisco, you know, people will isolate their focus on the person needing the transplant, not realizing that there's a much larger support group out there that needs support themselves. And, you know, that is available to people. It's just, you know, as you say, talk to the social worker at the hospital you're at, and like this, and they can point you in the direction to get you those resources that are needed to help you, because even support people need support.
Oh yeah, definitely. AST did just come out last year with a caregiver resource packet that is available free on their website. It's beautiful, so definitely check that out if anybody is a caregiver. It helps even patients, even if they're not caregivers. And there's a lot of resources out there, and starting with, you know, looking to see what there is online, asking your social worker, and just knowing that ultimately things are going to be done to help you at the end.
Okay, very good. Well, as we wrap up, I'm going to revisit the gotcha question I asked you from last year. You've got a very eclectic music library. And
I forgot about this.
Has your music taste changed?
Is it rap music?
It was hip-hop rap at the time.
Still is. Will forever be. We're in the Bay Area, you know, they have great roots here, so we'll always, it's always my go-to, and I mean, I'm open to other things too, but I do really like hip-hop and rap music.
And nothing to be embarrassed about with that. So again, Transplant Radio, World Transplant Congress 2025 in sunny San Francisco. Alin Gragossian?
You got it.
Hey, see, you only have to hit me about the head 2 or 3 times.
That's okay.
To finally get it. Thank you very much for
Thank
your
you so
time.
much.
Congratulations on all the wonderful things that you are doing now, and getting the word out there, the voice out there. And both sides of the stethoscope really strikes true as to the message that you spread. Is because you've got your clinicians on one side, but you've experienced the patient side of it as well.
Exactly.
And being able to tie that into humanized medicine is, I guess, the term that I'd use for it.
Yeah, exactly. I love it. Thank you so much.
Thank you. Take care.
Make sure to subscribe to this podcast and follow us on social media to stay up to date on all the latest information. If you want to help spread the word, please give us a 5-star review and tell your friends and colleagues to subscribe too. We're available on Apple Podcasts, Spotify, Google, Podbean, and more. With over 40 years of diagnostic innovation and specialized expertise in infectious disease, pre- and post-transplant, allergy and immunology testing for immunocompromised and critical patients, Eurofins ViraCore is committed to helping medical professionals, transplant teams, and reference labs get results faster when it matters most. ViraCore is passionate about delivering value to our clients by providing timely, actionable information, never losing sight of the connection between the testing we perform and the patients you serve.